Conflict, Delegation, and a Healthy Work Environment by Jennifer Higginbotham. Situation: conflict with a nurse coworker. Working on a busy medical surgical unit, it's not uncommon for nurses to cover each other so the other nurse can take a lunch. Nurses are entitled to a 30-minute break and sometimes two 15-minute breaks if possible. A certain nurse I worked with is always taking a little bit longer of a lunch break, and it takes additional breaks throughout the day, and this leaves me not only covering my own patients, but now I am covering for her patients as well, and this can put me significantly behind, and sometimes I can't get to my patients and give the proper care that I need because I'm covering her patients as well. And I want to confront her, but before I do, I want to do it the right way. And so after reviewing the conflict management steps, I was able to look at compromising, which each party gives up something they want. And in this case, I want her to come back at a decent time frame, and I'm sure she wants to keep taking her long breaks. There's also a competing factor when one party pursues what they want at the expense of the others, and this kind of seems to be coming from one angle. There's also a cooperation and accommodating when one party gives up or sacrifices to allow the other party to win, saying it's okay to keep doing this particular behavior. There's also a smoothing where it's kind of a pacifying, and it's more agreeing rather than solving the conflict. There is an avoiding where all the parties involved just choose not to acknowledge it or attempt to resolve it. And then there is a collaborating where all parties set aside and come together to resolve the conflict, which would be the best way to handle this situation. So before I do, I want to think about the steps to negotiation before I actually confront this nurse. And before I do, I want to be prepared. I want to do my homework. I want to make sure I'm not coming at her in a negative sense. I need to determine all the incentives for each parties involved, and determine my starting point. I don't want to just come in guns a-blazing. I need to determine the trade-offs and the bottom line, where I will stand, and then look for any hidden agendas. So during the actual negotiation, maintain composure. That's the first and foremost. But ask for what you want assertively. Use good communication skills, but also be willing to listen. Be patient. Take breaks if you need to, if it becomes too heated, or if any of the parties become angry, then you want to back off and take a little bit of a break. And then you want to avoid any kind of destructive negotiations. And after, you want to make sure that you restate what has been agreed upon. And then you want to recognize and thank everybody for being willing to negotiate. And you never want to use destructive negotiations such as ridicule. You don't want to put anyone down. You don't want to use any inappropriate questioning, making someone feel interrogated. You want to avoid flattery, saying you're the best nurse. This is something that you can handle. I know you can. And you don't want to come across as helpless, and you don't certainly want to make anyone sad in this situation. So also working on the same very busy medical surgical floor, a patient was to leave the floor for a surgical procedure, and the surgical team was there to get the patient, and the nurse that was working with me couldn't go and help, so I had to delegate to my patient care technician to go get vital signs for this patient. And I want to make sure that the 5 rights are there before delegation tasks are put off to the next person. So the 5 rights are the right task. I want to make sure that this task is appropriate to the person that I'm delegating it to, make sure that it's specific to that patient, and that the task itself is delegable. I want to make sure that it's the right circumstance. It's in the appropriate setting. I'm not giving this PCT something that they can't handle, and I want to make sure that it's the right direction, the right person. Make sure the descriptions are appropriate. I make sure, so if I tell her I need vital signs, I need to make sure that I just tell her I need a full set of vital signs, not just her to go grab a blood pressure for me. And then the appropriate level of supervision, monitoring, and evaluation, make sure that everything was appropriate. So one of the delegation errors that commonly happens is under-delegating. So when you under-delegate, it can lead someone to believe that they are not capable of doing the work, or that you are coming across a little bit controlling, and can be interpreted as a lack of ability. But then also to the opposite of that is the over-delegating, which is you can overwork, and you can sometimes come across as passing the buck to your patient care technician or to whoever you're delegating to. And then also improper delegation beyond the capability of the person that you're delegating it to. And it can lead to and this can lead to sometimes medical errors, and sometimes job satisfaction, making someone feel scared and inadequate to do their job. So all in all, with avoiding conflict and proper delegation skills, it's important also to create a healthy work environment. And so a healthy work environment is defined as a place that is safe, and it's for both the patient and the staff, and is empowering to both the patient and the staff, and it's satisfying for both as well, has a sense of professionalism, there is accountability there, and there is transparency among the leadership. So the components of a healthy work environment include skilled communication. This is keeping your staff in the know, and this allows to stop any of the rumors that could be forming because of why we're doing something, and it stops any guessing. So true collaboration is important, because it's important that you ask the staff kind of what their thoughts are, and especially if this is what's affecting them, and discussing the standards, maybe hosting learning events that help with the true learning, the true collaboration. Effective decision making, work with all the parties involved, especially if this is something that is going to affect their job or affect the equipment they're using. Appropriate staffing is important to complete healthy work environment, so everyone feels safe. Also, to creating a meaningful recognition. This shows appreciation to your staff, and just lets people know that you're doing a good job. Also, authentic leadership is important, because this puts the staff first. This is someone being genuine. So my present work environment I would describe as a healthy work environment. I feel like our staffing is appropriate, and I feel like our leadership is always trying to put the needs of the patient first. But if it wasn't, what would I do to make sure that is appropriate to, as an effective leader, to help create a healthy work environment? And it's important that your work life reflects your life values. How you feel at home and off the site is there, and helps create work-life balance. Also, happy workers equals better productivity. Happy employees are always more productive. Create a meaningful workplace, and this means something where people feel a sense of responsibility, as well as they take pride in what they're doing, and what they're doing has meaning. Work culture is important. It's knowing, engaging different personalities, and that your employees are what make up the cultures in your workplace. Set clear and fair policies, and again, this kind of protects all parties involved. And again, ensure safety among your staff. And that is what helps create a healthy work environment. So thank you so much for my presentation. I hope you learned something. Thanks.